Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Gollenville, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. So without further ado, let's get into this week's article titled, Arthritis, What Does It Actually Mean? Everybody talks about it, and most will experience it at some point in their lives. Arthritis. But what the heck is it? As the years go by, I continue to realize how much confusion circulates about this nearly ubiquitous ailment. So if you've been too busy or too afraid to ask the obvious question, today's your freebie session to understanding arthritis. What is arthritis? Arthritis is a condition that affects the joints of our bodies. So let's start by defining a joint. A joint is any place in the body where two bones come together. This is a fluid-filled space. A soft tissue structure known as the joint capsule, think of a thick water balloon type material, keeps the fluid inside the joint and links the bones together. Most of our joints exist in the limbs or spine, and movement through the joint is how we, move. Obvious examples of joints would include the elbow or the knee. Now, today's article includes a few key drawings that will help you understand the concept of arthritis, and I'll include the link to that in the show notes below. So what isn't shown in the first drawing is that the ends of the two adjoining bones are covered in a very smooth, soft cap made of a tissue called cartilage. In the next image, you'll see that in pink. Imagine a smooth surface like the cue ball in a game of billiards, but made of soft cushioned tissue like your ear or your nose. This is an absolutely flawless surface, along with the lubricating joint fluid that enables smooth, pain-free motion in the joint. This is why it doesn't feel like your bones are slamming together when you run, or at least early in life, your knees don't creak when you squat down to pick up a child. All right, now here's what you came for today. Arthritis, simply put, is any process that results in the breakdown of that smooth cartilage layer at the end of the bone. That's it. Plain and simple. Lose the cartilage? Now you don't have that smooth, gliding, pain-free motion. You instead have bumpy, grinding, and often painful motion. Your smooth white billiard cue ball just turned into a pockmarked white golf ball. Different types of arthritis. Now that we understand arthritis as the end result of a process, we can dive a little deeper. There are many different causes that will lead to that similar end result. The three most common pathways are osteoarthritis, which is sort of just aging arthritis, post-traumatic arthritis, meaning you had an old injury, or inflammatory arthritis, which is actually an autoimmune disease. Let's break each of these terms down into actual English. So osteoarthritis. Another term for osteoarthritis is degenerative arthritis. Yikes, nobody wants to hear that word. Whether we want to admit it or not, this is a normal aging process. The cartilage at the ends of the bones wears down over time. As this happens, the former smooth cartilage surface turns bumpy and rough. The two rough surfaces rub together as you move, resulting in squeaking, creaking, pain, and inflammation. Osteoarthritis is the most common type of arthritis, and also the one with which you are probably most familiar. Post-traumatic arthritis. Post-traumatic arthritis is arthritis that develops after an injury, typically a fracture that involves the joint surface. If you break a bone and that fracture cracks through the end of the bone, through the cartilage and into the joint, it obviously follows that the smooth cartilage surface will be altered. Even 1 to 2 millimeters of disruption will significantly affect the smooth gliding surface of the joint. This is actually why surgery is often recommended when you break a bone through the joint. Surgical realignment of the joint surface allows for the most optimal healing. But sometimes the damage has been done, and even with perfect surgery, this injured joint will have a lifetime increased risk of arthritis. Not guaranteed arthritis, but an increased risk. This subsequent rough joint surface causes pain and inflammation in the same way as osteoarthritis. Inflammatory arthritis. The final common type of arthritis I'll briefly touch on is the broad category of inflammatory arthritis. This type of arthritis is often the result of one of various autoimmune diseases. If you have an autoimmune disease, your own immune cells can mistakenly attack and destroy the cartilage cells in your joint. This again causes the same pattern of degradation that leads to an all too familiar cycle of inflammation and pain. Within this category, there are many different types of inflammatory arthritis. Some of the most common being rheumatoid arthritis, psoriatic arthritis, or gout. So some takeaways from today. Arthritis is a catch-all term that simply means loss of the smooth cartilage within a joint. Loss of smooth cartilage at the ends of bones can lead to pain and inflammation in a joint. And there are many ways our body can reach the same endpoint of arthritis, including aging, old injuries, or inflammatory diseases like rheumatoid arthritis. As you can see, the first step is to determine what exactly has caused your arthritis. The treatment for you will then depend on what your underlying cause is and which particular joint is affected. Stay tuned as we will have lots of ground to cover discussing various specific arthritides and their associated treatment options in future articles. Thanks for listening. See you next time.